Hi, I'm Alex.
And I'm Donna, and we are part of the urology team at Great Ormond Street Children's Hospital.
Today we're going to demonstrate how to insert a urethral catheter. We'll show you how to do this step by step.
This video will demonstrate the insertion and cares of a urethral catheter in a male child. It is intended to support hands-on training, not replace it. Start by preparing the patient. Step 1. Gather the equipment: latex-free sterile gloves, apron. A silver trolley is preferred as a workspace. You will also need a sterile dressing pack, a catheter drainage bag, a sachet of saline, water-based anaesthetic gel such as Instilla gel, a 10ml IV syringe, sterile water, latex-free adhesive tape such as Mefix or a Statlock, and an absorbent pad such as an Incopad. Step 2. Choose a catheter by using the smallest catheter that will work effectively to drain urine. Use a catheterisation guideline to size according to age and weight. Step 3. Lay the child or young person in a comfortable position with their head on a pillow. Place an absorbent pad under the buttock. Males should be semi-supine if possible. Step 4. The abdomen and lower legs may be covered with a sheet. A parent or carer should remain by the child or young person's head. Step 5. Put on an apron and perform hand hygiene. Step 6. Open the dressing pack and prepare sterile field, adding lubricating agent and catheter. If applicable, remove stylet from catheter. Open 0.9% sodium chloride and pour into gallipot within sterile field. Apply alcohol-based gel to hands and put on sterile gloves. Step 7. If using a Foley catheter, open the packaging of the 10ml syringe and add to the sterile field. Step 8. Tear a hole in the centre of the sterile sheet and place over the genitalia. Step 9. Gently hold the penis with a non-dominant hand using sterile gauze and pull it through the hole in the sterile sheet. Hold the penis vertically and prepare to clean it. Step 10. Using gauze soaked in 0.9% sodium chloride, clean the foreskin with a singular motion. Where possible, continue to retract the foreskin until the foreskin will retract no further or until the urethral meatus is visible. Clean each area of the foreskin and glands with a new piece of gauze. Step 11. Whilst holding the penis at a 90-degree angle, insert the nozzle of the lidocaine gel into the urethral meatus. Administer the gel, massaging it downwards into the urethra by digital stroking, and wait for 4 minutes. Step 12. Ensure that the child or young person is ready for the catheter insertion. Step 13. Lubricate the tip of the catheter with lidocaine gel. Gently insert the tip into the urethral meatus. Insert the catheter with a slow, steady motion. When the posterior urethra is approached, where resistance is felt, point the penis towards the end of the bed to enable the catheter to pass around the posterior urethra into the bladder. Step 14. Continue to insert the catheter until urine drains freely through the catheter. If using a Foley catheter, insert to the hub before inflating the balloon. Step 15. Insert a syringe of sterile water into the one-way valve. The amount of water will be dependent upon the size of the catheter. Remove syringe. Pull back the catheter gently to ensure it is sitting comfortably. Step 16. Ensure the foreskin is reduced to the normal position at the end of the procedure to prevent paraphimosis. Step 17. Attach a sterile drainage bag. Place the bag below the level of the bladder. Step 18. Secure the catheter to the abdomen or groin using adhesive strapping or a Statlock device. Do not tape to the child's leg. Step 19. Dispose of the equipment according to the Trust Waste Policy. Perform hand hygiene. Step 20. Following catheterisation, the following must be recorded on EPIC. Date and time of catheterisation, batch number, reasons for catheterisation, type of catheter including length and size, volume of sterile water injected into the balloon, any problems encountered during the procedure, review date and date to change the catheter.